is cell wall inhibitors, and cell wall inhibitors are the most safe antibiotics because and this is also the first antibiotics that are discovered, so because it includes penicillins. Penicillins are actually the most safe antibiotics at the moment. And also the cell wall inhibitors include cephalosporins that have a similar chemical structure, and also carbapenems and monobacters. So these are the four groups that are beta-lactam antibiotics, and this is the most part of the cell wall inhibitors. And there is also a vancomycin that is not a beta-lactam but also has the same mechanism of action. So the mechanism of action of these antibiotics is inhibiting the cell wall synthesis, and particularly peptidoglycan synthesis that is additionally covering the cell membrane of the bacteria, especially the gram-positive bacteria. So that is why, for example, penicillins are more effective against gram-positive bacteria than gram-negative, unless the special penicillins that are extended spectra that also cover gram-negative and other bacteria as well. And also there are beta-lactamase inhibitors that are sometimes combined with the antibiotics to extend further their spectrum of action, and so actually that is it. So of these groups, the cephalosporins is the largest one because it has the broadest spectrum of action, and also spectrum, and also is effective for most of the diseases, including the central nervous system diseases, and that is why there are five generations of cephalosporins, and they are commonly used in medical practice. Then penicillins are usually mostly used in the outpatient treatment because most of them are taken orally and they have good tolerance, so less adverse effects, so and are very safe, including the children and children and elderly patients. So that is it. And the antimicrobial spectrum of penicillins includes the so actually we will start with the structure. So the structure of the penicillins is has a beta-lactam ring that has this ketchup group and is 4-atom ring with a nitrogen. So this is a beta-lactam ring that is important for the activity of the antibiotic. So the destroyment of this link by the bacteria or by the acid in the stomach may decrease the efficiency of the antibiotic or completely remove the antibiotic action, efficiency. So that is why it's important to protect this ring. And then the R is actually can be different in different penicillins, and is determining the pharmacokinetics of the drug and also the duration of action and sometimes a little spectrum of action. So the beta-lactam ring is fused with the 5-atom cycle with a sulfur, and also has a, uh, acetyl group uh, uh, at the back. And so this actually together, this uh, two rings make a 6-amino penicillinic acid. So we have acidic group here. So the molecule is a weak organic acid, and actually uh, all uh, all penicillins are the derivatives of the 6-amino penicillinic acid. So this is a mini group. This is a penicillinic acid. The cephalosporins are the derivatives of the 6-amino penicillinic acid. Uh, and the mechanism of action is based on the inhibition of uh, uh, the side chains of the peptidoglycan. So peptidoglycan is composed of from the N-acetylamino uh, N-acetyl uramic acid and N-acetyl glut glutamic acid. So these are interchanged, and then they are connected with the uh, side chains, and this is the site of the action of the penicillins. So they are replacing this, and that leads to the cell wall that is not solid and can be easily destroyed, and that's why the bacteria will not survive. So this is the mechanism of action for the penicillins. Um, um, and then uh, the the antibiotic spectrum of most penicillins include the mostly gram-positive bacteria, and most of all the bacteria that will lead to the pneumonia. Streptococcus pneumonia is actually the most common uh, viral agent. So the most common bacterial agent that is used to treat with, and penicillins are commonly used for the pneumonia that is not resistant to the beta-lactams. So because there are different types of the pneumonia, and usually the one that is obtained in the community, so not in the hospital, so is not resistant, so it can be um, treated with the penicillins. Uh, and um, Then the Streptococcus pyogenes and viridans. So pyogenes is uh, leads to some um, many diseases of different types, not necessarily pneumonia, that leads to the increase in the temperature, and viridans is also like maybe different diseases. So actually, this is Streptococcus. So the main indication for the treatment with the uh, penicillins, including penicillin G. So this is actually the basic spectrum of the penicillin. So all penicillins will be effective against these drugs. Then gram-positive Bacillus anthracis is anthrax. So anthrax is actually very uncommon now because of the uh, completely destroyment, so it's actually hard to find this disease. So because it's completely cleaned from the surface of the area of the world, so only can be seen in two places in the world, in CDC in USA, and in the Russia there is a special Novosibirsk lab, the microbiological lab, that these two institutions store the samples of these bacteria. And then Corynebacterium diphtheria. Diphtheria is actually very common. This is actually gram-positive and can be treated with the penicillins. Then gram-negative includes gonorrhea, that is the very common disease in United States because of the transfer uh, with the sexual intercourse, and is very common uh, in in those patients who have multiple partners, and also can be seen in newborns in form of the blenaria, and that is why uh, the silver nitrate drops are used uh, in the eyes of the newborn to prevent the gonococcal ophthalmia, that is called blenaria in newborn. Uh, and also nowadays gonorrhea also actually is this Neisseria gonorrhea, again negative cocci, and Neisseria gonorrhea is actually can also be resistant to the penicillins. So in that case, we need to treat it with ceftriaxone, that is third generation cephalosporin. That is usually done in the hospital because it is injectable. So it's intramuscular injection should be used for that. Then Neisseria meningitidis is causing the disease of the inflammation in the central nervous system. So and also should be treated with cephalosporins because penicillins uh, are not effective for the central nervous system diseases. So then Clostridium perfringens is anaerobic, is also very rare disease, and Treponema pallidum is probably most common disease because it's also very common in Russia. So syphilis or trepak is actually also transferred with this with the sexual intercourse, and is a venereal disease. That is why it's venereal disease, and but it is not resistant to the penicillin, so that is why actually can be easily treated with the penicillins. So this is the basic spectrum for the natural penicillins, including penicillin G and penicillin V. So that are obtained from the fungi Penicillium chrysogenum, and there are also a semi-synthetic penicillins that include the amoxicillin and ampicillin. That is so that actually the synthetic penicillins are divided to the anti-staphylococcal that are also like dicloxacillin. There are also acid stable, and these include dicloxacillin, naphthalene, and oxacillin. And methicillin is discontinued because of the toxicity to the liver, so these anti-staphylococcal penicillins are mostly used for the treatment of the staphylococcal infections that usually produce penicillinases. So penicillinases destroy the penicillins. That is why the natural penicillins are not effective against the bacteria that produces penicillinases. So that is why one should use those drugs that are resistant to the penicillinases, or combine the antibiotic with a with a uh, penicillinase inhibitor. So that can be a clavulanic acid or sulbactam, depending on, or also tazobactam, depending on the antibiotics, so different antibiotics are combined with the different penicillinase inhibitors. And then there is an extended spectrum. Sorry, there is an extended spectrum antibiotics, ampicillin and amoxicillin, and these are also effective orally, so they are also stable to acid. Because the natural penicillins are not, like penicillin G is not stable to the acid, so it's only injectable. And ampicillin and amoxicillin are effective orally and are extended spectrum antibiotics. Extended spectrum means that they additionally cover enterococci, that is also gram-positive, and Listeria monocytogenes. So, and additionally they cover the hen. Yes, they cover hen. So this is Haemophilus influenza, Escherichia coli, and Neisseria meningitis. So, and also Salmonella typhi, Proteus mirabilis. So these are the gram-negative extension for the ampicillin and amoxicillin. So then also we have Antipseudomonal Penicillins that are, we have two, piperacillin and ticarcillin. So as the name tells, it's penicillins that are effective against Pseudomonal bacteria. So that is why they additionally cover the Pseudomonas aeruginosa. So they cover everything that the ampicillin and amoxicillin, so as an extended, like the Escherichia, Proteus, the Haemophilus influenza, and additionally they cover Pseudomonas aeruginosa. That is not covered by the ampicillin and amoxicillin. So they also have combinations with the inhibitors of the penicillinase, like ticarcillin plus clavulanic acid and piperacillin plus tazobactam, and that makes them stable to the penicillinase. So these are also should be taken by injection. So that is why mostly used in the hospital. So of all these penicillins, amoxicillin is most commonly used at the moment. So because it has a broad spectrum and also available orally and high bioavailability results in less adverse effects from GI, and also it can be combined with the clavulanic acid that extends the spectrum in case of the penicillinase producing disease, like for example the some pneumonia, Streptococcus pneumonia, for example, some resistant strains. But the most of the time, amoxicillin itself, even without clavulanic acid, is enough to cover the disease. So that is why actually the most commonly used drug nowadays is amoxicillin. Like ampicillin is close, so it's also can replace amoxicillin, but the bioavailability is less and requires more frequent dosing. So amoxicillin requires twice a day, ampicillin requires 4 times a day. So amoxicillin is actually has dosing twice daily up to So ampicillin is actually 500 four times, 500 milligram 4 times a day. Amoxicillin is only, I think it's uh, 500 twice a day. Yes, so usually twice a day 500, or can be taken even 1,000 once a day, but it's better twice a day dosing is better. So actually the most common dosage but can be increased up to 4 grams per day if required, but is less tolerable in high doses because of the adverse effects. We will talk about adverse effects later, so because they are common for all penicillins. So and the uh, uh, there are also methicillin resistant bacteria that actually is not covered by any beta-lactamase, so any beta-lactam antibiotic. So and uh, that is actually uh, is a great problem with the in-embodied antibiotic therapy. So because more and more bacteria now is resistant, uh, and there are also uh, so adverse reactions include the hypersensitivity. So hypersensitivity is seen commonly with the penicillins. Uh, about 5% of patients have some uh, uh, some allergy reactions like angioedema, the some skin reactions like swelling of the lips, tongue, or the even the anaphylactic shock. There is also a cross allergy with the other beta-lactam inhibitors. That means if a patient has an allergy to penicillins, he will probably also have an allergy to the cephalosporins and carbapenems, but not monobacters, because monobacters are different in the chemical structure. They don't have a fused ring. And then they also can lead to the GI disturbances, including the diarrhea, except for the amoxicillin. Amoxicillin does not have a diarrhea, and uh, and but all including the amoxicillin may lead to the diarrhea because of the uh, disruption of the uh, normal intestinal microflora, because antibiotics will kill the normal microflora, and that will lead to the diarrhea. So, and after discontinuation, the patient has uh, to recover that uh, microflora. That usually takes several weeks. Uh, and also uh, many uh, it's many physicians will suggest to use the special drugs to recover the intestinal microflora, that are probiotics, but unfortunately they are not effective on case of the antibiotic treatment, so that is why please don't sell them for the patients. So instead you can sell them a yogurt that is uh, at least is tasty, but will also not help to recover, but at least it's tasty and then actually nutritious. Then next adverse effect is nephritis. Nephritis is seen with the methicillin, and that is why methicillin is uh, no longer produced for the treatment, so it's not a drug anymore. So then neurotoxicity is common and with a large doses and more than 2 weeks indication treatment. There may be some uh, neurotoxicity like seizures and the feeling of the at the end of the fingers. There may be a pain and so but it is completely reversible, so after discontinuation of the drug the seizures will uh, uh, disappear. And then there is some adverse effects to the blood that some penicillins including piperacillin and ticarcillin can decrease the coagulation in at high doses. So and the blood should be monitored in those patients. So these are all the adverse effects, so they are actually mild and usually there is no problem with the adverse effect with the penicillins. So then there are cephalosporins, and cephalosporins are very close to the penicillin, so the difference is that the structure is based on the 6-amino penicillinic acid, so they have a 6-ring fuse. So here there is a 5 atom ring, and cephalosporins have a 6 atom ring fused with a beta-lactam ring, and they are also ineffective against the methicillin-resistant Staphylococcus aureus. That is a common problem. So, and the first generation of the cephalosporins, so actually this is a the first generation has the same spectrum as penicillins, so as a natural penicillin. So like this, so this is the spectrum for the first generation cephalosporins. So so first generation is so cefazolin and cefadroxil. So and so that is it. So actually, and cefalexin also. So and then the second generation has a greater activity against gram-negative microorganisms, and they cover the Haemophilus influenza and Neisseria gonorrhea and also Enterobacter species. So additionally to the cephalosporins, they cover the HEN, like HEN means Haemophilus influenza, Enterobacter and Neisseria. So abbreviation is HEN to easy to remember the spectrum. And the third generation is the So the third generation is has the greatest spectrum of action, and they additionally cover the gram-negative bacteria, including all of the previous one, plus Serratia marcescens. And Serratia marcescens is actually uh, uh, is not commonly seen, but actually only covered by the third generation, and also the Pseudomonas aeruginosa is also covered by the third generation. And these most of them are used intravenously, so the uh, and they are mostly used for the treatment of meningitis because they have a good penetration to the central nervous system, including the ceftriaxone and cefotaxime that are usually have high concentrations in the central nervous system. Uh, Then the fourth generation includes cefepime and ceftaroline. Cefepime here, yes. Cefepime and ceftaroline. So here they are in alphabetical order. Ceftaroline here. This fourth generation is only available parenterally, and cefepime has a widest antibiotic spectrum, so still methicillin resistant is not covered, and they additionally cover the Escherichia coli, Klebsiella pneumonia, and Proteus mirabilis, and Pseudomonas aeruginosa. So they actually cover everything uh, that is gram negative and also gram positive, and also though there are some uh, Pseudomonas aeruginosa that are already resistant to the fourth generation. Then there is also an advanced generation that includes ceftaroline. Actually, ceftaroline sometimes is referred as the fourth generation, but some authors they think ceftaroline is actually the fifth generation or advanced generation. So it's also administered intravenously, and is also and it covers the MRSA. So the MRSA, and that is why the ceftaroline is actually referred as an advanced generation. So usually used for the treatment of the MRSA and that with the Streptococcus pneumonia. So and also it covers the everything that is covered by the previous generations, like the Klebsiella, Proteus, and but is not covering the Pseudomonas aeruginosa and some extended spectrum beta-lactamase producing Enterobacteriaceae, and also the Acinetobacter baumannii, that is a completely new organism, and also actually the broadest spectrum available. So there is also resistance for the cephalosporins, so the same mechanism as for the penicillins. So most cephalosporins are administered intravenously or intramuscularly, and that limits the usage at home, so only can be used at the hospital. And adverse effects are the same as for the penicillins, but they are well tolerated. There are some adverse allergic effects, and the patients can be seen with, they may have anaphylactic shock, the Stevens-Johnson syndrome, or the toxic epidermal necrolysis. So that are actually the common adverse reactions. So there is a cross allergy with the penicillins and other beta-lactam antibiotics, and actually that is why if patient has an allergy to penicillins, cephalosporins should be avoided as well. So the next group is carbapenems. Carbapenems are synthetic, completely synthetic antibiotics, the same as cephalosporins, and in these drugs, the sulfur atom of the thiazolidine has been externalized and replaced by a carbon atom. So the result is that we have imipenem, that is always combined with the cilastatin because of the toxicity, and then meropenem, ertapenem, and doripenem. So Dory, like a fish name, Dory from the cartoon. So so imipenem is always combined with a cilastatin because the metabolism of the imipenem is toxic without that. And then the carbapenems are resistant to the beta-lactamases, and this that is why they don't require protecting with the beta-lactamase inhibitors, and is usually used for the treatment of the Pseudomonas aeruginosa diseases, anaerobic diseases, and actually they have, so all the carbapenems have the common spectrum, and they actually cover everything like Pseudomonas aeruginosa and Enterococcus, so gram-positive, gram-negative, anaerobic, and the imipenem is administered intravenously, and but not good. Penetration is not good to the central nervous system, so that is why meropenem is better for the meningitis. And the metabolite of the imipenem is toxic for the it's nephrotoxic, and that is why it's always combined with the cilastatin that protects the formation of the toxic metabolite. Fortunately, other carbapenems like doripenem, ertapenem, and meropenem does not require the cilastatin because they don't have toxic metabolites. So, for example, ertapenem administered they are also administered intravenously or intramuscularly, and actually that also limits their home usage. Adverse effects include nausea, vomiting, diarrhea because of the microflora disruption. Also, eosinophilia and neutropenia, and then high levels of imipenem can provoke seizures. So but usually are not seen in low doses. So and the last one is the Monobacters. Monobacters has only one antibiotic as Fluranam. Monobacters are unique between the in this group because they only act against gram-negative pathogens, so there is no activity to gram-positive, and they are also resistant to beta-lactamases because of the differences in structure, and also only available intravenously or intramuscularly. So the adverse effects include the phlebitis at the place of injection, skin rash, and sometimes liver functions are bad. So usually the Astranum does not have cross hypersensitivity with the other beta lactams like penicillins, for example. So that is why it's a good alternative for the treatment for patients who are allergic to penicillin, cephalosporins, and carbapenems. Then there is also vancomycin and other antibiotics that are like daptomycin, like mycins, polymyxin, telavancin, and fosfomycin. So these are the tricyclic glycopeptides that are very important in the treatment of MRSA. Also, MRSA is methicillin-resistant Staphylococcus aureus, and also methicillin-resistant Staphylococcus epidermidis. That is an enterococcal infection. Staphylococcus aureus is actually pneumonia, so the pneumonia infection. So vancomycin actually has been used for a long time for the treatment of these infections. And also the Enterococcus faecium and fecalis, that is an enteric microorganism. So vancomycin is actually usually is reserved for the serious infections of the intestine caused by the resistant strains. Is administered intravenously and also because it's not absorbed by oral administration, and orally can be only used for the treatment of Clostridium difficile that is so it will not be absorbed, but it will only will effective for the enteric bacteria, so no systemic action. So and other mycins are actually have almost the same indication, also used only intravenously. So for the resistant strains are actually reserved for the resistant strains, and usually require careful dosing and monitoring. So usually only in the hospital, used only in the hospital. So that is all beta-lactam antibiotics. So if you have any questions or comments, so then please feel free to leave them below. And thank you for attending the lecture. See you next week.
Thank you.
Thank you, teacher. Goodbye.
Bye bye.
Can I have one question?